Hi, everyone, and welcome to the SRHM podcast. My name is Nina Sun, and I'm an associate editor for the SRHM Journal. Welcome to another editor's summary episode, bringing you the latest research, viewpoints, and review articles appearing in the journal. Today is a special episode because we get to speak with one of our own. I'm pleased to chat with Laura Ferguson, a fellow associate editor here at SRHM. She's also the director of research at the University of Southern California's Institute on Inequalities and Global Health and an associate professor of population and public health sciences. Joining her is Sarah Emoto, a research program specialist at the Institute. They're here today to talk about their new paper, Laws Governing Access to Sexual Health Services and Information, Contents, Protections, and Restrictions. Welcome, Laura and Sarah. It's great to have you here. Can you speak a little bit about the rationale or gap in knowledge that your article speaks to? Why was it important to publish on this specific topic?
Sure, I'll make a start. And thanks, Nina. Thanks so much for having us here. I think that this article felt particularly important at this moment in time when we're seeing a lot of retrogression around sexual and reproductive health and rights generally. And the whole topic of sexual health is sensitive in many places, but it's also so important to people's lives. And there has been quite a lot of work to understand and to influence laws around certain areas of sexual health, things like abortion, obviously, also laws that criminalize same-sex sex. But we hadn't seen anything that was broad. And so we wanted to try and look a bit more holistically. And of course, to go beyond just looking at whether or not a law exists, what laws actually say, the issues and populations they cover, as well as, I guess, the issues and populations they leave out, are all really important. And we didn't have a sense of that from the literature in relation to sexual health, which I think was a lot of the reason why we went into this. But I'll let Sarah add.
Yeah, just to follow that, another piece that we think just in terms of why this was important to publish was the process itself. We think that it's useful for other researchers, both on this topic, but then the WHO Global Policy Survey covers a lot of different topics. And this is just one way to leverage the data that's already there. It's already been collected. But it also goes beyond just looking at the survey answers, as Laura said, not just whether there's a law, but what that law says. And this was the first round of the Global Policy Survey where the WHO actually encouraged countries to upload laws that substantiate their answers so that then allows researchers to do this kind of deeper dive analysis of not just what the survey answers are, but what are in these documents that countries are uploading.
Thanks, Sarah and Laura. So you've spoken a bit about the global policy database, the surveys that are available and why it's important and why this article adds to that type of information. So taking from a different perspective, could you tell me what stood out to you personally from the findings of this article?
Yeah, I can start with that. So a couple of things. One of the more specific things that stood out to me based on what we actually found in the laws is that the two most frequently covered services were general medical care without specifying if that included sexual health services, and then STI and HIV services. That stood out to me because there's decades-long work in sexual health to try and bring it beyond treating disease and to include the more positive elements in promoting sexual health to be this more holistic state of well-being. And at least on paper and within the laws that we looked at, it seemed like there's still this emphasis more on treating the disease. So that was one piece that stood out in terms of the findings. And then a broader piece of the findings is that just all of the variation that we found at different levels that we looked at. So there was variation in the types of laws. So some of these laws were specifically dedicated to sexual health. Other laws were more general health laws. There were child codes, penal codes. So even as all these countries were filling out the same survey, the types of laws they uploaded were very different. And then within those laws, there's variation in how many services were covered, which services were covered. the non-discrimination provisions, there was variation across the different characteristics covered. So to me, that's interesting because there's a lot of discourse on, are laws supportive of sexual health or are they barriers to sexual health? And I think the conversation is a lot more nuanced than that, because it's all of these laws that ensured a service are supportive laws, but they all look very different, both as laws and then also the way the countries are covering services in different types of laws.
And if I can just add to that, I think that for me, that's exactly what stood out, was that the laws are all over the place. And if I were a service provider, I think I'd find it difficult to even know where to look for this information. And remember that health workers are generally not given a lot of training in health-related law or rights. So when you get this mishmash, I'm not sure the technical word for that, of laws, it's really difficult for service providers to know what their legal obligations are, as well as, of course, for clients to know what their entitlements are. And so particularly when we're dealing with sexual health, which, as we said, is sort of this taboo topic in many places still, this lack of clarity feels really problematic to me in terms of how this all plays out on the ground.
That's so fascinating. Thank you for sharing. So in light of this mishmash, in light of this potential confusion, interesting findings that you have, where do we go from here? What do you believe are the next steps now that we have this evidence?
Yeah, I think so. Laura kind of started to get into this in her last response, but at the country level, at least, one of the next steps is, how are all these different types of laws implemented? And then are there any patterns that either make them more effective or less effective? So, for example, in our data set, we found many more of the non-specific, more general laws than we did of the sexual health specific laws. But what we don't know is how that impacts implementation. So like, does the type of law it's in matter, or does it just matter that those services are covered? And for the countries who had their services piecemealed throughout several different laws versus countries who had all of the services covered within one law, how does that compare for people who are trying to access these services on the ground? And then the other piece to that is, we also know these laws don't exist in a vacuum. So there may be other laws within the country's legal framework, or there might be policies that also interact with these laws. So a next step at the country level would be to take these findings and see how what's covered here on paper compares with both the broader environment and then also with people's experiences trying to access these services.
Yeah, I mean, I fully agree with that, and obviously just would love to add a little bit. I think one of the questions that's still out there is, how best should law be used in the ambit of sexual health? Because we see it being used in so many different ways. And to me, the core is, well, the law should be seen as a tool to promote equitable access to sexual health services and information. But how best to do that is something that we don't yet know. So I think that's some of what Sarah was alluding to there. I think we also need to ask what other data sets exist that might be leveraged to kind of expand this analysis to a broader set of countries, a broader set of laws, to also look at policies as well as laws, because again, there's a lot of data out there that just aren't being looked at in this way. And I think that ultimately Sarah's right. This is about people's lives. So what the law says on paper is a super important starting point, but we have to have some in-depth country work that can look at laws, policy, and their implementation and accountability. So things like what training takes place around a law, what budget is allocated to it, what is the health system capacity to implement, what are the sociocultural norms that might affect its impact. And honestly, I think there's a lot of focus on changing laws, trying to improve laws, which is, of course, very important. But we also need to learn how to make the best use of any good laws that we have that might promote equitable access to sexual health services.
How fascinating. Thanks so much, Laura and Sarah, for joining us today and for engaging in this insightful conversation about your article. Please check the show notes for a link to the SRHM journal, which also has a link to Laura and Sarah and Sophia's article. The journal is available online and open access. Follow SRHM Journal on social media and sign up for our newsletter to receive notifications for new publications. If you are enjoying our podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM Journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautombe.